Hello, I'm Robert. Welcome to my channel, a fact check and helping people who are scared of many things. And this time, this is an article I wrote, and basically it's trying to help encourage any decision makers, and influence UK government. That's basically what I'm trying to do here. But I'm also helping scared people, and there's so many people in this situation around the world, actually in different countries. So so many experts, many people I follow on Twitter, and the World Health Organization have been warning against rushing too fast and opening up too fast. And this is one particular reason why we shouldn't do that. And the experts that I follow are pretty clear on it, that we just shouldn't do this. It's not the right decision. And so I'm going to first of all, say a bit about that, and hopefully as an influencer in my own little bit, trying to influence a change in policy, adding to all the thousands of other people who are trying to do that. And then I'm going to talk about what we can do as individuals in a situation where there's huge community spread going on around us, encouraged by the government, and just opening up and letting it go through. And there's so much that we can actually do as individuals to protect ourselves and the community around us. And so I'm going to talk about that. And then to give you some optimism about the future, we have these wonderful vaccines already, and more vaccines coming on their way, and they're going to be able to target the variants, and lots of other things which I'll talk about in a separate video, lots of wonderful new developments coming along. This is not going to go on forever, and if the United Kingdom just waited a few more weeks, it wouldn't happen. And that is just the so frustrating thing about this for the experts. Just a few more weeks, and we've got 17 million people who are totally unvaccinated and never been infected with COVID in the United Kingdom. The virus is just going to go through those people until most of them are infected. And with the use of a vaccine continuing for a few more weeks, then many of those will be vaccinated instead of infected, and get their immunity through a vaccine instead of getting it through getting the disease. And then with such a high level of immunity, then it'll be easy to stop it from getting to the rest of them that are not vaccinated yet, such as the younger kids. So anyway, that's why the experts I'm following say, it's just not the way to do it. And the World Health Organization, the very scathing thing so I'll come to that in a minute. But first of all, I'm going to talk about the title of this article, the main title. And this is a document that was released by SAGE, who a very strange situation that we have in the United Kingdom. SAGE provide these secret briefings to the United Kingdom. And of course there are plenty of other scientists, but these are the ones that advise the UK government. They are actually very expert now in COVID. They also have access to data that other scientists can't access from the schools and so on. And there's some very expert modelers involved in there as well. And this report must have been written before the 7th of May, because it doesn't even mention the Delta variant, which was already identified as a variant of concern on the 7th of May. And it's released on the 6th of July, the day after the United Kingdom finally made its decision to drop all restrictions on July the 19th. This can't be a coincidence, one day later. And I don't think this is it's certainly not for economic reasons, because wearing a mask, the Asian economies with people habitually wearing masks all the time, they hum away, and there's no economic impact on wearing a mask. Now, you don't get people in Japan or China or Singapore saying, we've got to stop wearing masks because of the economic impact. They just wear them anyway. So there's absolutely no economic impact from wearing a mask. It's just gut feeling thing, and people, makes them popular, and the we've got basically a totally unscientific government. I don't believe that their advisors are advising them to stop wearing masks, to tell us to stop wearing masks. And so to the topic of this article. So this is one of the things that they said in this paper that was the UK government must have read way back in May. And Scotland, for instance, doesn't get to see this didn't get to see that until the 6th of July. And the opposition in the main government, they don't get to see that until July as well. So it's just the UK government, just Boris Johnson and his cabinet probably, but the only people who have seen this for 2 months in the entire world. And so it says that there is significant risk in allowing prevalence to rise. So this was back when levels were very low, and it must have been written when levels were falling. So before the levels started to rise, which they did before we moved to step 3. And it says, even if hospitalizations and deaths are kept low by vaccination. So even the few hospitalizations and few deaths are rising, but only rising very slowly. The problem is that if it's necessary to reduce the prevalence to low levels, in other words, go down to low cases per day again, once you're up to 100,000, it's suddenly important to get down to just a few cases per day. Then then the restrictive measures would be required for much longer. So think how long it took to get down. We're already at levels similar to in January. Think how long it took to get down to these levels from the January levels. Months. And with a more transmissible variant like Delta, it'll take even longer. And if there's another new variant of concern that comes along, it'll be even more transmissible in Delta, so that makes it even longer still, even more difficult to bring down. And then they give an example of why we might want to do that. For instance, if the variant of concern becomes more pathogenic for others previously less affected. They don't give any actual examples there, but certainly the things that people have talked about, so I can talk about those. So when Delta started to spread in the United Kingdom, one of the concerns was that it might be more deadly for children. So it hasn't been. It doesn't seem to be more harmful for children, or for young people, or for young adults, the ones who are not vaccinated, including in their 20s as well. But a new variant can still come along that is more deadly for younger people. So what we do, if this is now spreading through the 17 million unvaccinated people, what we do if a new variant starts, when we're at 100,000 cases per day, we detect, that'll be next month, and we detect that there's a new variant. And we've got everyone being encouraged to go off on holiday. And this means that if there's a new variant anywhere in the world, in any of the hospital destinations, they're going to bring it back. Just like they did it with the variant in Spain in 2020. That was a variant that wasn't any harm, it wasn't a variant of concern. It was just a slight change. But before long, just about everyone in the United Kingdom had the Spanish version of COVID in autumn. It happened very fast in autumn 2020. So if somewhere out there, in some of the hospital holiday destinations where there isn't much sequencing, suppose there's some variant that is like this. So another thing that is an issue with a new variant is if it has vaccine escape. I'll just talk a bit more about the kids thing. We also have long COVID. And we already know that 8% of kids have long COVID for at least 3 months, I think it is the 8% figure. So off school, or if they do go to school, they're just not feeling very well, they can't think very clearly, they're very tired all the time, they can't do their sports activities. And for at least 3 months. And then you have, then some of them have been off sick for much longer than that, And a few very unfortunate kids are still sick 15 months later, still can't think clearly very well, still very, very tired, still find difficult, always kind of low energy, not running around like kids do. They say that the way to recognize long COVID is, for instance, if a kid that used to take part, a young kid, used to take part in activities in the playground, they just sit on the bench and watch the other kids playing, because they just don't have the energy to do it themselves. And we don't know the long-term effect of this on kids. So there may well be, but they don't know, it might be that some kids that have been infected with long COVID are going to be infected for their entire adult lives, affected in some way, reduced lung capacity, reduced ability to think clearly, all the way through to adults. That the experts are forewarned that this is not known. And now suppose a new variant comes along that is even worse for kids. It doesn't kill them, but they're very sick, and it seriously affects them all the way through their life. And we don't know this is not going to happen. And if that starts happening, then because we really don't understand viruses very well. There's no way to predict. We can't just go to a computer and tweak it a bit and say, well, suppose this happened and suppose that happened, what will it do to our body? We just don't have that level of knowledge of how gene sequences changing, interacting with the proteins that they form and then interacting with our bodies, what that does to the symptoms and the long-term effects. We can't do that. Maybe in 22nd century they'd be able to do that, but we're a long way from being able to do that right now. So the only way we can know is when it actually happens, and then looking and see what it does to our bodies. Even a very small tweak of a few amino acids changing, we can't predict what it's going to do. All these variants of interest, we have no idea what they do to our bodies until they start spreading. And then if they do harm us in some way, they're called a variant of concern. If they don't, they're not. And that's the only way we can find out. And then the other risk is that these new variants could be... So remember, I'm going to tell you how to protect yourself from all this and what you can do to help others. So please, and remember that this is all going to be over. I'm going to explain how it's all going to be over in a few months. That most of this, that we've got these marvellous vaccines coming along sometime in 2021, and it's going to be hugely tamed on just about any scenario. It may still be continuing with the way we're encouraging it to spread through to 2023 or so, but we got these wonderful vaccines. They're incredible, the pace of scientific advance, and I can't see it continuing for very long, not for years and years. So then another risk that they mentioned, so now I'll go and look, this is, I'll talk about it separately in a separate video. She talks about that we're already seeing the impact, a palliative care doctor, we're already seeing the impact on our health systems of having to turn patients away, needing life or death, needing cancer patients, needing surgery. It is life that is helping them of life or death consequences, that some of them might die because they haven't got the surgery, because they've got risk of cancer and they didn't are being turned away. And this treating cancer early, of course, is very important. So here is the World Health Organization make these same variants. This is a warning about the variants of concern. Delta variant is more transmissible than Alpha. Alpha is more transmissible before Delta, and there'll be more variants. And the new variants will be more transmissible. This is my summary of the World Health Organization, of what Dr. Maria Van Kerkhove said. That's what viruses do. They become more transmissible as they evolve. They don't have a brain, they're not thinking, but they are evolving. And we expect more variants. This is not to strike fear, this is reality. Variants that are more transmissible without vaccines, to stop them is a dangerous situation. So let's see if we can reverse course correct right now. Let's turn the corner and get these cases per day going down again. That's Dr. Maria Van Kerkhove. And here is Dr. Tedros. That's what viruses do, they evolve. But we can prevent the emergence of variants by preventing transmission. It's quite simple. More transmission, more variants; less transmission, less variants. And I did a blog post about that, and where I talked about how we're running at about, this is just to give you an idea of how it works, we're running at about one new variant every 25 million cases. So, roughly speaking, that 70 million people in the United Kingdom, and that's maybe not a new variant, it's quite possible, together with the ones we've already infected so far. It could easily have another variant after Alpha that could, for instance, emerge in the United Kingdom. And then some of the, I haven't got the one, yes, this is another thing that's coming up. The United Kingdom is creating the perfect conditions for a variant to evolve that evades vaccine immunity. And that's because we're encouraging it to spread with lots and lots of people who have no protection, and then we've got about half the population also is vaccinated. And a new variant that comes along that can evade vaccination, that we have lots and lots of chances for the virus to mutate. And any mutation that evades vaccination, even slightly, will mean that mutation can then spread just a little bit faster because it gets to some of the vaccinated people. And then once that one starts spreading, then it'll start mutating, and then a little mutation on that will make it even more able to evade the vaccines, and there could be another variant after that, and then another, just very minor tweaks, changes in the protein, and just a few amino acids at a time, and then spending a bit of time in an immunocompromised person that's vaccinated, so it stays in their body for a long time. And so we can gradually, and then that happening several times over. And so this is my summary again. The variants spread because they're more transmissible. The variants so far were able to outcompete viruses because they infect more people. But the UK has a population with many more immune people than any population where variants emerged before. So before, the advantage of the variant was just to spread through people who had never been infected. So the selection pressure is to evade that immunity. And so it would be the same if it's in a population like it happened in Brazil, where the P1 variant probably arose. That's which one? That Peter, I think that's the gamma one. Then that one arose in a place where there was very high prevalence of natural immunity. So if you've got natural immunity and then you've got a new variant, you've got the virus evolving there, and that's a situation where it'll escape from the natural immunity. And at large, we've got a highly immune population with a mixture of vaccine-derived and natural immunity. And a large epidemic in a relatively highly immune population can lead to new variants that can escape that immunity, because now there's a huge evolutionary pressure on the virus spreading in the United Kingdom to evade the immunity. And for instance, if the virus starts spreading in care homes, then any virus that gets into a care home that can evade the immunity, and we know care home is a place where viruses spread very easily, very quickly, and any variant that can get there and that can evade immunity, then it's going to go all the way through the care home again, and it's going to go to another one and another, just like happened before. So, and then if it can evade, and this is Dr. Sammy, a Scottish immunologist on Twitter. Dr. Sammy, I've got a spelling thing. I've got a funny thing. I tend to those things just run past my eye and I don't see them. I'll change that to an S. So, Dr. Sammy, she says, let's not start with the fact that letting a virus rip through a population where 40% of adults are partially vaccinated is exactly how I would structure an experiment to evolve a strain that leads to complete immune evasion. In other words, that over time allowing us to go on and on and on in this situation, and eventually, just a few amino acids at a time, a new strain is going to evolve that eventually will evade immunity completely. That's both the natural immunity and the vaccine-induced immunity, because it's got a huge evolutionary pressure to do that. And so what are we going to do? What is the UK's plan B if that happens? We obviously, if that starts to happen at 100,000 cases per day, we're going to have to react very promptly and try and stop it. But when you've got community transmission everywhere, intense community transmission everywhere in the country, it's not easy to pick out a particular variant and stop it. So if this happens, we're headed for lockdown again, yet again. And this time it would last longer than the last one. The vaccine, well, not necessarily, because we do have the vaccines coming along, but if it's a new variant that escapes vaccines, then we will have to vaccinate everyone again. But luckily with just one shot, with the booster shot, and the people who've already been vaccinated have got used to being vaccinated, but we all have to go in anyway. They're planning to vaccinate everyone over 50 in the September anyway, but they would need to vaccinate everyone again if this happens. And that would take months. And during those months, we wouldn't want to just let it spread and spread. So we'd be headed for another lockdown. And it would last about as long as the last one since January. It might last longer because it's a more transmissible variant, so it's quite hard to control. And so this is my thing. What is UK's plan B? It took 18 days to halve the cases from January 9. We're likely to be slower with the new variant because it spreads so quickly. So we had 100,000 cases per day. We suddenly decide we've got to reduce it quickly. Then it would be a couple of weeks before it's down to 50,000 cases per day. And then another couple of weeks and it's still at 25,000. Another couple of weeks it's still at 12,000 cases per day. Another couple of weeks it's 6,000 and so on. It would take a long, long time, starting from 100,000, to get all the way back to where we were in April, where it was a few hundred a day, I think it was. So, what is UK's plan B? And as far as I can tell, it's not even being discussed. So the experts asked the UK government, what about a new variant? They just don't answer the question. So I don't think they've even thought about this. I don't think they're being evil. I think they're just non-scientific gut feeling, this annoying question about new variants again. We don't have, and they just ignore it and they sidestep the question. I don't think this is intentional in any way. And as I said, there's no scientific reason for delaying the publication. And this is the summary of the other things. So it would get very long if I talk about that as well, but there are a huge number of other reasons which the Independent Sage have been saying all the way along. This is Professor Christine Pagel of Independent Sage. And in the United Kingdom, Sage, they were originally completely secret in March. Nobody knew who they were, apart from the government and maybe a few others. Now we know most of them, but if a member of Sage doesn't want to be known, then they don't get their name released. And they never talk directly to the public as Sage. We don't get Sage press briefings. All we get are government people and the spokespeople, but not the actual Sage group. And the people who talk to us only talk about what has been cleared for the public to hear, and they don't answer questions. So all these briefings that we get from the UK government, they never mentioned any of the conclusions in this document in May the 7th, because it hadn't been released for publication, so they couldn't talk about it. Very, very strange situation. I don't know if there's any other country that does that. I don't think China even does. I don't think China does that. The United States doesn't do that. I don't know of any country that is so secretive about its scientific findings, important scientific findings about COVID. And we are in a situation where we have some of the best modelers in the world. We have some of the best data in the world because we can collect it. We've got very good data collecting capabilities. We've got the very best sequencing in the world. We sequence, is it half of all the cases of all the positive cases are fully sequenced all the way. And no other country can do that because we prioritised that early on. So we're a huge potential source of data for the entire world, but it's all hidden like this. It only gets released often weeks or months later by the government. And then the experts ask questions, and they can't ask the scientists directly. and there's no peer review. Nobody else can, they don't even talk about their methods. Generally the reports don't have a methods section explaining how they came to their conclusions. They just give their bare conclusions. It's very, very bizarre to someone with a scientific background. I've never seen anything like this. So Independent Sage do talk to us every Friday, and so you can go every Friday. You can go and get an Independent Sage a briefing, and I recommend, if you want to know about the UK situation, then they do talk about it in a scientific way, and scientists talking to each other and asking questions and so on. And we just don't have that with Sage. It's so strange. I just don't understand it. That is to say, I understand why it's happening politically, but this needs, for future pandemics, I think this needs urgent reform. This is not the way to deal with science during a pandemic, when it's very urgent for people to know the true situation as soon as the scientists need to decide it's time to release, not the politicians. Anyway, so it would take a long time to go through all that. But one of the things they do mention in this report, the importance of face coverings. They do mention the importance of keeping cases low, maintaining low transmission, and of having some measure of control. And they give the example of face coverings. In New Zealand, for instance, uses face coverings even with very low prevalence. And they say that we should do the same. And this is why I don't believe that the scientists of SAGE have advised the United Kingdom that it's okay to lift, that removing the requirement for face coverings is a good idea. That's just political. There's no scientific basis for that. Just doesn't make any sense. And they actually say there that keeping some level of measures through the summer, this is my paraphrase of what they say, I just put it a little bit more direct and simpler construction for autistic people. Keeping some level of measures through the summer and beyond would significantly decrease transmission. That's what they said on May 7, before even the Delta variant. Countries with near zero COVID like New Zealand retain baseline measures like masks on public transport to reduce the impact of occasional outbreaks. So given they said that in May 7, I just do not believe that they have advised the government it's okay to lift masks. And they talk about how the modelling suggests a possible hospital wave as large as in January. That's again written before Delta. And the experts have been asking the UK government over and again, what does the modelling suggest as the maximum number of hospitalisations with their plans? And they just are not answering, deflecting. They're saying, we will release this later. They probably won't release that information until after July the 19th, when it's too late to do anything. And then they'll say, oh, there's so many thousand hospitalisations predicted, and so many deaths. And this is their advice, and again, this advice the UK government is not following. Improving isolation is so important. So anyway, so what do you do? What can you? And it talks about this is something the World Health Organization have talked about over and over again. Except they're more or less given up talking about it now because they're not. The people are just not changing very much. But it's very important to isolate from other members of the same household, especially so with Delta. They say that if everyone who gets COVID symptoms was to immediately self-isolate, the R would be reduced by 50%. So it's 1.5, 0.75, it'd be going down fast. With a 1-day delay, it's reduced by 39%, so if it's a 2-day delay, it's reduced by 25%, but it's still significant, especially with other things like masks. And so that highlights the importance of isolation from the onset of symptoms, not just receipt of a positive test result. The United Kingdom is going the other way. They're saying we're not even going to require doubly vaccinated people to isolate, which would make a big difference to the R0 as well. That's my own example. Even 1.05, which would be a very slow rise, and then other interventions could reduce it if you have a 2-day delay. And this would need isolation even within the household. Many people with symptoms of COVID don't get tested, but many do isolate after they test positive. So that's the thing of telling people about symptoms and encourage them to stay at home, even if they've got mild symptoms, and then many who are self-isolated are not able to isolate from other household members. Now, so these, that's, I say, not a hidden agenda, just a non-scientific, populist government. And this thing about hospitalizations don't decouple the vaccination. It's not a correct way of putting it. The admissions are up to 70%. There's an 11-day doubling now. There's a 9-day doubling for cases. There's an 11-day doubling for hospitalizations based on the very recent increases. Well, it can't continue like that. That it's 11 days for hospitals and 9 days for cases. That doesn't make mathematical sense. Hospitalizations will be a fixed percentage of the cases, or they will trend towards some endpoint of a particular percentage of the cases. It's only if it's moving to a different population, if it's moving towards elderly, then during the transition, then the hospitalization was actually double faster than the cases. If it's moving towards younger, then during the transition, it would rise slower than the cases. But just during transition, and then they're in lockstep together, that whenever the cases double, if it's say 3%, if it's say 30 out of 100, then you go to 200, then you've got 60. So the doubling time for the hospitalizations is soon going to be 9 days, because that's what the cases are. And I don't need to go into all that, I'll do that later. This is the WHO, that Dr. Mike Ryan was very dismissive of this was the BBC asked, a reporter from the BBC asked the UK what they thought of the UK's idea of delaying, of having the wave now rather than in September. And Dr. Mike Ryan said he doesn't think that's their logic. So he just doesn't believe that that's what the scientists are saying. Then he said the logic of more people being infected is better has proven its moral emptiness and its epidemiological stupidity previously. Then he did a very dramatic mic drop. He went very, he went, like, see if you can see it, just like that. That's all I've got to say at the end of his statement. Just very dismissive of the idea. I seem to have got, and that's it also from the, well, I seem to have got it twice, I don't know why. He explains at the end that he honestly thinks that deliberately permitting infection is not the aim of the UK government. He says he's sure that excellent scientists that advise the UK's health system will open up very cautious and be really ready to adjust that opening up according to epidemiology. Well, I don't think it's the scientists. I personally think it's the government, the politicians. I think the scientists are giving them good advice. I don't think the politicians are following that advice. That's happened over and over again in the past. Like when the scientists recommended a 2-week circuit breaker in autumn 2020, and the government just ignored that advice. I think that's all that's happening there. So now, what can we do ourselves about all this in this situation we're in? First of all, I strongly recommend that you go to the World Health Organization for good advice. The UK scientists are very good, but they're not the people who are talking on television. And the ones who do, like the ones who talk as spokespeople, they're very limited in what they're permitted to say, because they can't talk about the SAGE findings they've read about until, Dr. Whitty, for instance, he can't mention this SAGE report from May the 7th until the government releases it. So you have to be a bit of a politician to actually even find it acceptable to be in such a situation. It must be very difficult for him to just not be able to talk about the things that he knows. So go to the World Health Organization. They follow the entire world situation, not just the situation in the United Kingdom. They have the access to more data than of anyone, and they do a living systematic review. And as soon as they they have things that they know to the and they've got scientific strong support for it, then they say it straight away. And the scientists decide when to talk about it. There's no political oversight of the World Health Organization. It is a scientific body, and when the science is clear, then they say it. And they follow the process of a living systematic review, which is a process where the scientists themselves are not able to control what the outcome is. It's carefully set up. So that's why people who try to put political pressure on the World Health Organization to come to certain conclusions, it just doesn't work, because they use this process of a living systematic review, and when that living review does reach those conclusions, which is out of their control, it just depends on what the science says, then they will say them. That's how the World Health Organization works. They're very good people to follow. Then Independent Sage. So I would follow Independent Sage, because it actually has turned out that this briefing back on May the 7th said all the things that Independent Sage have been saying for the last many weeks. Nearly all the things they've been saying. So if you've been following them, you'd already be up to date on all that. Now, this is about how we could do a huge amount. So I said I'd talk about this at the end. We can do a huge amount at an individual level. Please don't feel powerless. It's certainly right to be worried about this. So I talk to people who are worried about things that are totally impossible. This can't happen at all. But this isn't one of those. This is a real thing that's happening in the world. It's right to be worried, but it's not apocalyptic. It's a realistic worry with potential for something similar to what happened in January already. So we've already lived through something very like what we might have to face again. And right now, if you're a young person, unvaccinated, if you're unvaccinated in the United Kingdom, whatever your age, then your risk now, especially when it reaches 100,000 per day, is higher than it's ever been in the pandemic. It's the highest it's ever been. So don't believe the government hype that it's all over. With higher levels of infection in the community than there's ever been since the beginning of the pandemic, then of course your risk is higher than it's ever been since the beginning of the pandemic as well, unless you're doubly vaccinated. If you're one single dose vaccinated, it hardly makes much difference with the Delta variant. If you're double dose vaccinated, so long as we don't have a vaccine evading variant, then your risk is reduced. It's only reduced maybe 10-fold or 20-fold with Pfizer. And so it's not zero, even if you're vaccinated. And then but the Delta variant is spreading rapidly in the UK due to high-risk activities. For instance, we've seen all the celebrations about the UK getting into the final for football, and see all these people just dancing around. They just don't. They're taking the government message, just taking it as on face value. They're just saying, "Oh, we're over. It's all over. The adults are vaccinated. We younger people are not much harmed by this. We don't need to do anything." And they're just dancing around, and no physical distancing, not a mask to be seen in sight. Those are the people it's spreading through. And before long, all those people will have had COVID, all except a few percent, 80%, maybe 90% of them will have had COVID. It's just if they engage in if you engage in activities like that, in where this rapid community spread, eventually most people will get COVID. That just cause and effect. But the people, it might take the entire summer before they've all got it, but eventually we'll all have it. And but the people who are not doing that, who are much more careful, then you are protected from that, and you have a much lower risk. So even if you're doubly vaccinated, it's very important if you're doubly vaccinated to continue to be careful. And at the moment it's spreading mainly in 15 to 25, the Euro champion things, whatever it is. I have no interest in football myself, personally. I never have been. I'm interested in Olympics and individual sports. For some reason I'm just not interested in most team sports. So I don't know much about these things. but I like tennis as well, but I don't know why. I'm just not interested in football. Never have been. But for the people who it's the people who celebrate like this, they are the ones it's been spreading around very rapidly, and also they've been going back to parties and so on. And so, if you're in that age group, then if you want to reduce your risk of COVID, then wear a mask, be more careful, you celebrate but in a more careful way. That's if you're doubly vaccinated, then World Health Organization advises that we can, like I'm double dose vaccinated, I should say double dose vaccinated, not doubly vaccinated, sorry, then that's all, we can still infect other people. And there's an example from the times of Israel, a vaccinated person, and they had vaccination very early on with Pfizer, the most effective vaccine of all. A vaccinated person returned to Israel from London. They gave the virus to another vaccinated person. That vaccinated person then gave it to a school child. And that school child then infected 75 other school children at the end of the term party. So now turn that around and think about it positively. So by being careful and by not wearing a mask, by physically distancing, by doing whatever you can to make sure that no chains of transmission can pass through you to other people, then you are, at some point or other during the summer, you're very likely to break at least one chain of transmission by doing that. And that chain of transmission, especially in a situation in the United Kingdom with rapid spread, could easily have gone on just a few things down the road. It could be 100 people, could be even 1,000 people if they then go on and infect others after a while. And with the world so globally connected, then that could be people not in the United Kingdom, it could be people in Brazil, in India, in Africa. So by stopping that transmission, then you, by being careful all the way through the pandemic, then you, without knowing it, are saving the health and, in some cases, the very lives of probably dozens, maybe hundreds of people around the world, just by stopping the trains of transmission that could have gone through you. And then if you do get sick with COVID, then immediately, as soon as you have symptoms, even if you feel just slightly unwell, then isolate at home. And isolate away from your household members as well as you possibly can. The World Health Organization gives advice on how to do that. And again, by doing that, maybe you get sick, but you can protect your household. And if you are very prompt, and Dr. Mike Ryan gave an example of one member, some relative of his, a young child, was feeling a bit unwell, and she thought she had COVID, and the rest of her family thought, no, that doesn't sound like COVID, but she was insistent on it, and she isolated from the rest of her family, and it turned out she did have COVID, and none of the others got it. So this is something you can do at an individual level. You don't need to wait for the government to tell you to isolate. If you have symptoms and you think you might have COVID, immediately isolate. Don't wait for your antigen test. Do your antigen test, but even if it isn't, the antigen test doesn't pick it up straight away. So if you get feeling a little bit symptoms a bit like COVID, and if you want to be really, really careful, then isolate right away, like this young child, and I think nephew and niece, I think it was, or something like that, of Dr. Mike Ryan, like she did. I think it was a girl, maybe a niece maybe, or something like that. I'm not sure what the relation was. So this could, and then you can do your own contact tracing. So if you get a positive test, then you don't need to wait for the government to phone all your contacts. You can remember all the people that you've been talking to, and nowadays even quite brief contacts could pass it on. So you can just advise all these people and say, I ring them around and say, I saw you yesterday, I've got COVID, you might like to continue, if you could consider isolating as a contact. You don't need to wait for the government to tell them to do that. It depends, of course. I know there's all this problem of resources, finance, and how you can do it and so on. But at least they need to it's let them know there's a possibility they might have got COVID from you, and then they can make their own decision about what to do. There's another idea here. Now, I haven't heard anyone suggest this for quite a long time, but this is something that was discovered in China in January 2020, not January of this year. I think it was January or February. They discovered that people who habitually wear masks at home, even before any of them have COVID, then they had about a quarter of the transmission of those that didn't habitually wear masks. So if you want to really reduce the chance of passing it on to other people in your household, one very simple thing you could do is all of you wear masks. Wear fabric masks at home during times when it's very intense community spread, especially if some of you are out in the community and it's unavoidable, frontline workers or something, unavoidable contact with people in the community. And say you're a shopkeeper, for instance, then everyone in the home could wear masks in order to reduce the risk of you passing it on to other people in the household. So if this is for people, I'm not saying to mandate this, just if you want to be super careful. So I get people who ask me, what can I do? I'm scared because of all the community spread in my area. What can I do to be safer? And this is one thing. If you really want to be very, very careful, you could wear masks at home just habitually, and just for a few weeks over the summer while it's at its worst. And that would reduce the risk of being transmitted to other people in the home. So that's just me talking. So perhaps I do want to signal that that's just me presenting you with some evidence. And this is not official advice, I think. But if you really want to be super careful, it's something you could do. But certainly out of doors, if you're walking through a crowd, you're wearing a mask. There's this example from Australia where one person passed another with they got very brief, they were just walking in opposite directions, they faced each other for a short period of time, 10 or 15 seconds, and the one case passed on to the other. Now, it doesn't mean that everyone who's a COVID case is going to pass it to everyone else when they walk past in the street. It's obviously not doing that. It would be spreading very, very fast. So it's not doing that. But on very rare occasions, then it does happen, as Australia found out. So this person walked past many people in the shopping mall, and one person in the shopping mall got COVID, and walked past another couple of people, and that also got COVID. One going out of a cafe, and just walked past someone who was sitting outside the door of the cafe, and they got COVID. So so this shows that it's really, you're going to reduce transmission a bit by wearing the mask always out of doors, even just walking past people in the street. That was not the advice for the ancestral variant, where this took 10 or 15 minutes. And now, this is just a thing about it being, it's not seasonal. This is a very strange thing that the UK government is saying. They're saying, we want these cases surged now rather than in winter, because flu is seasonal, because COVID is seasonal, because COVID will have an advantage in winter over summer. But they're saying that in the middle of the fastest surge we've ever had. So flu would never do this in summer. So it's deeply unconvincing to say, okay, it's obvious that COVID is seasonal, so that's why we're opening up in summer. Look how quickly it's surging. It doesn't make sense. It's obviously not seasonal. If there is a seasonal effect, it's very minor. And the World Health Organization say they've not been able to see any seasonal effect yet. So I know there are people and this is Dr. Maria van Kerkhove again, next step is not inevitable. People want COVID to be predictable. They want it to have seasons. The virus is not behaving in a seasonal way, which is completely clear. You just don't see that. Maybe in the future the virus will have some seasonal patterns, but right now we don't see seasonality. And it's very strange. We get some experts saying, oh, there's a seasonal effect, there's probably a seasonal effect. And in the modelling, SAGE had a 10% or something seasonal effect. But it's not seasons, it's people associating with each other and being in close contact with each other, which tends to be more in winter. But if you're in a football crowd celebrating football, then that's just the same as if in winter or summer. It's what you do is what makes the spread, not the temperature. Right now we don't see, maybe in the future it will have some seasonal patterns, right now we don't see it. And then she says again what Dr. Mike Ryan said, but in a bit more detail, the idea that we have to prepare for a surge shows how much we, the World Health Organization, have failed in our ability to explain. We need to be ready, vigilant, invest in those symptoms right now. We don't prepare for a future surge because it's not seasonal. We respond right away. So you go and listen to that broadcast there. And then, so the government says, well, if we ease up now, when are we going to do it? And they say, well, we'll ease up if we don't ease up in the summer, we can't ease up in winter because it's seasonal, which it isn't. So they say, therefore, we have to wait until next year. Nobody's saying that. The people who are saying we need to delay it are saying we need to delay it for a few weeks, not saying we've got to delay it to 2022. That's a straw man argument, a technical term for it. They're claiming that they have to open up now because if they don't, it'll be in 2022. But the government is the only people saying that if we don't open up now, we have to open up in 2022. The experts are saying if we should wait until September. Just wait for July, August, and then September, and we'll have enough people vaccinated to open up. And it will not surge in winter because we'll all be vaccinated. And that'll stop it surging, or if it does, then even if cases do rise in winter, then nearly everyone will be vaccinated, so they won't get the sickness. Or if they do get sickness, it's very mild because the vaccine also reduces the risk greatly reduces the risk of dying, greatly reduces the risk of hospitalisation. They don't know, but it probably reduces the risk of long COVID as well. And then lots of people vaccinated means any outbreaks are easy to stop. So they're not saying to wait till 2022, they're saying wait till September. And this Kit Yates, mathematical biologist, he just says, Boris Johnson, if we don't go ahead when we have the summer fire break to help us, when do we open up? When everyone's had the chance to be doubly vaccinated, question mark, exclamation mark. It's just dumb. This what the UK government is saying, just very, very stupid. They're clever people. Boris Johnson he could have been a fine don, fine classics don. He got a 2-1 in Greats, which means he's probably fluent in Latin and Greek, and probably knows all Greek, Latin classics, and can probably write fluent Latin and Greek, probably write poems in Latin and Greek. But just doesn't think scientifically. And so these are things you can do. You can share high quality information to help protect your community in real life or online. So explain all this to other people around you. Help them to understand what they can do to protect yourself, that this really is a serious situation. We really should stop transmission. Help connect them to good sources like the World Health Organization and Independent SAGE. I know some people say, oh, Independent SAGE is left to wing or something. They're just people who are. There's one member of Independent SAGE who is a member of the Communist Party and has been for many years. That is not a reason. It's just like saying, there's one member in Independent SAGE who is a member of the Conservative Party, so it's conservative. It just doesn't work like that. These are just experts who are independent of the government. And what party someone belongs to has nothing to do with their medical advice. you don't go, when you go to a doctor and you know, if you're sick and you go to the doctor and say, you know, I've got these symptoms and that symptoms, you don't say to the doctor, and are you a member of the Communist Party? If you are, I'm not going to see you. It just doesn't. We don't even think about the politics of our doctors. So you can. I strongly recommend. I've not seen anything political, anything left wing in the Independence Age briefings. Just science. So you can have listened to the Independence Age briefings, and that sadly at the moment that's the best way to keep track of what's happening in the United Kingdom. I strongly recommend following Dr. Christine Pagel, who gives very clear assessments of the situation every week. Then, as for the governments, I mean, there's no way that this video is going to make any difference to our government immediately. And you know, even if I suppose that I could, which I don't have, and I tried writing to a letter to Boris Johnson, just got no reply, and that was way back in March 2020. I tried writing to leaders of all the parties about a decision to abandon test, trace, isolate at the beginning of March 11th and 2020. Many people don't realise they actually had test, trace, isolate, and they abandoned it on March 11th and only brought it back again at the end of the first wave. And lots of scientists say don't abandon it. So I wrote letters to all the leaders of the political parties, to top medical people, to the Prime Minister. I didn't get an answer back from any of them. I think I just got a deluge of letters from people saying hundreds of different things during the pandemic, and it's very difficult to get through to them. But suppose that I could, you know, so counterfactually, against actual facts. Suppose that I could have a private audience with Boris Johnson to say, just that, and I could spend half an hour talking to him or something. But it wouldn't change anything, because he'd be very clear. He's very clear. You see where he answers to experts anyway. You just wouldn't listen. So governments are. I think of them as a bit like a supertanker. That they change very. They've got huge amount of inertia, kind of muscle memory. All the people around them, all the backbenchers who are supporting the Conservative backbenchers who've got the same gut feeling as Boris Johnson, they've all have to be changed as well. Everyone's got to change their way of thinking. So it's not going to happen suddenly, but it can happen through just lots of people talking like I'm talking, you talking, and people just general awareness in the public of what's going on. And so there are hundreds of scientists on Twitter, for instance, that I follow, and they're just talking about this incessantly on Twitter. And around the world, the entire world's looking at us and saying, and if they're scientifically minded, just saying, how dumb? Why are they doing that? How strange? So, and then yet again, we may see the effects of it all. And as Dr. Mike Ryan said in the press briefing on the 7th of July, whatever it was, he said this what the government is what these he's talking about governments around the world who are opening up too quickly. He says this will have consequences, and he hopes that we don't go back to hospitalizations and deaths that we had in the spring. He says that is not a given. We don't go back to that. So it's very hard to influence governments, but please don't feel discouraged if you're talking about this and nothing seems to be happening. They're like supertankers, but they do change, but they don't change as a result of people arguing with them. They change as a result of a change of the opinion in the entire population and the politicians around them and so on. They're very good at just arguing back and deflecting questions. So it's not easy to change a politician by arguing with them, but they do change as a result of the of public opinion. They're very sensitive to public opinion, and we can't do much to change governments, but we can do a lot. And as I already explained, that by your individual actions, it's so interconnected. individual actions without knowing it, you could today have done something just by being a bit more careful. It's going to, a couple of weeks from now, save hundreds of people with COVID in distant parts of the world. A child in the United States or Africa or Brazil or India may be spared from long-COVID because of something, because we were just a bit more careful today. Some of them may even be scared of be saved from death. And collectively you can help to turn this around. As she said, and I did the shortened version up there. And so we are expecting to see more variants come. That's not to strike fear, it's a reality. More increased transmissible variants without the vaccine coverage is a dangerous situation. So let's course correct right now and see if we can turn the corner, make sure that those trajectories going up start coming back down again. We can all do that. I end this article with some people you can follow on Twitter, and that was just the ones on the day I wrote the article. Lots of good advice. People can follow on Twitter who give very good advice. So, and that's Rachel Clark. He's and that's I've got to fix that. The rest of the article is missing. I said this little thing, a little glitch. Oh well, I'll fix that in a bit. So I think I've got the other one here. I'll go back to this. Can you see that? It'll be done. This is my caller version of it. I may have to adjust the screen a little bit. See if I've got some of the rest of it. Oh, it's just saying where to follow me and so on. So I'll add that to my Science 20 article. So that's me done. Okay. So yes. So I'm just going to say for my that we welcome. You can follow me on my core blog and on Twitter. And this is the our Doomsday Debunk group, voluntary fact checkers to help scared people. And where we don't do positive spin or sugarcoating, we help them to access the best information available, fact check the infodemic and fake news. And for genuine situational concerns such as COVID, global warming, and biodiversity, we use positive framing. So positive framing is like what I did today about saying by your actions you're saving lives of these people around the world. It's absolutely true. It's not positive spin. I'm not pretending something it isn't true. It's absolutely true. And this motivate people to action by, and you need 3 positive framings to every negative framing. I have rather focused these, rather a little bit the other way around with this video, but I am going to upload another video that is just very, very positive, which about positive developments in vaccine development. So I will do that in my next video after this one, a long video, I'll do another long video about all the positive things that are happening in vaccine development and the light at the end of the tunnel. We are going to get out of this. The science is absolutely marvellous what's happening with the science. So so please, for a bit of encouragement, and I'll add a link to that video, to the video description here once I've done it. Meanwhile, I think I've said enough on this. There's lots more there that we could cover, but I've said enough, so I will stop this and upload, and hope this helps some of you.